Good evening, Malaysia, Australia, and followers from around the world. The COVID-19 pandemic is the most talked about issue right now. Besides the daily statistics on the outbreak and the kind of vaccinations that we should accept and the general discussion on its impact, there's actually very little, if not zero discussion on pregnancy and COVID-19. And we know how important it is. What are the risks for severe weakness in illness for pregnant women, and what are the steps to be taken if you are tested positive? Our guest for tonight is Dr. Premitha Damodaran. She's a consultant obstetrician and gynecologist. She was also an associate professor on these subjects at the University Hospital. Joining us is Ms. Zunaira Saieed. She is a business journalist and a broadcast presenter. She has a PhD and a master's degree
God,
in
why
business.
did you have to say that?
But more importantly, she's a mom. So I think she knows the subject better than me. Okay, welcome, Dr. Premitha.
Thank you very much for having me here. Good evening.
Okay, let me shoot the first question. Okay, what is the current procedure for pregnant women who has been tested positive with COVID-19? And what are steps being taken right now?
So, anyone, it's just like anyone else, men and women who have been tested positive for COVID, immediately the PKD is informed.
Okay.
And once they are informed, then they would look at who is at high risk. Pregnancy equals high risk.
I see. Okay.
So once you are pregnant, you fall into a different category, which is the high risk category. And automatically in this country, up till today, all pregnant women are warded for observation for at least 10 days. Because the women who are pregnant, they fall into a very high risk group. And for me, because I'm an obstetrician, I would clearly say that a woman who is pregnant, your risk factors go through the roof. As it is, when you are pregnant, your body is sort of making itself adapt to a baby that's growing inside. So your immunity comes down to help with that particular baby. So that's why it's very easy for a pregnant mom, especially, Zunaira, to get a simple flu or cold, because the immunity is so different. So what happens if she gets COVID? Mm-hmm. So when she gets COVID, then we know that in pregnancy, your risk of going from a simple category 1 to 2 to a more serious category is so much more higher.
Okay, but this is certainly this is true. But when I went into labor, I was not tested for COVID. It happened to me. I was not tested for COVID. And do you think that the government should make it compulsory for women to be tested for COVID before they go into labor? Because I know the last thing on a pregnant woman's mind when going into labor is COVID. I mean, that's the last thing she thinks of, because at that point of time, she's thinking about, how do I get this baby out, right? So what kind of procedures have the health ministry actually issued to private hospitals?
So going back to the first question first, so in the sense that when you're pregnant, as I was saying, you move categories much faster. So when you get COVID towards the second half of your pregnancy, your risk for ICU, ventilation, and all that go up. So for us, having COVID in pregnancy is a big thing. So that's one area. Then coming back to your question, Zunaira, I think having someone who is pregnant and having COVID, we need to know as a healthcare worker. So it, of course, differs. May I ask where you delivered? Did you deliver in the private or in the government?
I think more importantly, when was it? Because it's automatic. Like if you go into an operation or a surgery, you have to do a COVID test.
Any admission to any hospital, you don't even have to go in for surgery. So even if it's an admission to the hospital, you are actually doing a COVID test. Yeah. So it right now at the moment, when you get, I'm going to talk about what happens in most private hospitals in the Klang Valley, if that can give you a sort of an example. Yeah. So by the time you reach 37, 38 weeks, the couple, that means I'm looking at both the husband and the wife, yeah, they are already doing their COVID tests. And then it depends on that hospital's policy. How long would this COVID test be valid for? Would it be valid only for about a week? Would it be valid for 2 weeks? So let's say I get my patient to do a COVID test today at 38 weeks. Then I would get them to do it again at 39 weeks and 40 weeks until they deliver. So that in that way, we are trying to cut down the risk of a COVID mom or a COVID mom's partner coming into our delivery rooms and then spreading it all around. So that is when we can control a situation. Of course, with obstetrics and delivering babies, sometimes we cannot control situations. So let's say that you come in as an emergency or you've not done your COVID test then what routinely happens in probably all of the private hospitals is that you and your partner will be in that room. The nurses that attend to you would be in PPE. You would get your swabs done immediately. And until those results come back, because we have different types of PCR tests, and we can get them out by 4 hours, 5 hours. And until that time, whoever is handling you would be in PPE. And this is to protect our healthcare workers. So this is generally the rule now.
Okay, Dr. Premitha, we know that when someone is tested positive and they are in their late stages, right now they are sent to specific quarantine centers. Okay, are there specific areas or specific sections in these quarantine centers for pregnant women?
Okay, so when you know how many weeks pregnant you are, you only go to the maternity block. So basically, second half of the pregnancy, as far as I know, in the Klang Valley, if you're going to Sungai Buloh, you would go to the maternity wards. If you're going to JHL, you would go into the maternity hospital. So this is how it works. So there would be special equipped wards for the pregnant mother. So you're not with the common crowd at all. Yeah, so that way your monitoring is better. You have to monitor the baby in you, the mother, so both would get monitored equally. So that's what happens. Now, if you are lucky and where you are going to deliver, your doctor at that private hospital is willing to admit you to look after you in that hospital if there are beds now, because nowadays we're all running out of beds.
Okay.
But if you have the beds and that the facility is there, lucky you, get in and get looked after in that private hospital.
But have there been rising cases among pregnant women getting COVID?
I guess so, because it doesn't mean that COVID would not attack a pregnant person. So if I'm looking at the general numbers, I'm going to extrapolate from those general numbers and say, yes, of course, I'm sure there would be more and more pregnant women who are getting COVID. That's a general rule. But if I look at my own patient population and I look at my own hospital pregnant patient population, I know many of them who've already got their COVID. So we call them now post-COVID, or who get COVID closer towards delivery, then we manage them differently. So it is definitely happening more. Or it may not be them with COVID. It might be their partners or spouses with COVID. And when their spouses are having COVID and they are now in labor, they are actually treated as positive. Because they can become positive a few days down the line. So that's what I had. So both were tested, and the husband became positive. And then she went into labor the next day. I had to deliver her, but I had to treat her as a positive. And true enough, 2 days later, she became a positive.
Oh my.
Yeah. So so we have to treat you as a positive if your first contact is a positive, but you have been negative so far, because we know it might be just a process that in a few days you would be positive.
So when the baby was delivered, was the baby also positive?
the wonderful thing is that, around the world now, we know the stats that the risk of the baby getting it is like 1 in 50. Very, very, very low. Wonderful thing that nature has done. So the baby is sort of so protected. But where the baby gets it from, I will tell you. So now we look after our patients so well. We teach them how to look after themselves before delivery. We take care of them during the delivery, and then they go home.
Oh, okay.
And then they go home, and then the visitors are there, and then everyone is around there. And that's where the stats actually show that the babies get positive at home when the visitors come in.
Okay, you mentioned a baby that said is not is what's called it is negative. Okay, and then that we do not know, because as you say, people come and visit. Oh no, baby is born, everybody gets excited. The grandmother gets excited, the father is excited. That
normal, it's very normal.
Yes, yeah, it's normal. Okay. If the mom is positive, is the mom allowed to hug the baby, hold on to the firstborn baby once she delivers the child?
So, that's so we can't help it, but this is the way it is. And COVID has changed our management and taken away bonding. But this is how it works. So if you are in labor today and you are COVID positive today, it is a straight cesarean section.
Okay.
The reason is because we cannot allow a normal delivery with you huffing and puffing and all our healthcare workers around and they getting COVID. So it's basically for their protection. So it is a controlled environment. So it is a cesarean section and you don't even see your baby. That's so heartbreaking, but there's nothing we can do. So the baby is cared for separately. The mother is cared for separately. And this goes on for 10 days.
Okay.
So now, initially, in the early part of the year, breastfeeding was not even allowed. All right. So mothers who are positive could not even breastfeed their child. But now we allow what we call expressed breast milk. That means that the mother can pump and then the milk is sent to the baby. The reason is we do not want that contact. So the contact is what makes the baby positive. So the mothers in other countries, like in the West, in America and UK, the mothers are actually allowed to breastfeed directly, but they are given very strict orders. It is sanitizing your hands, it's wearing a mask, you have a visor, and you only hold your baby for the purpose of feeding. But if possible, you are staying more than 6 feet away from your baby and others look after your baby, if that is a possibility. So that's what happens.
What kind of advice would you give to pregnant women how to not get COVID? I mean, you do have patients coming in that are COVID positive. So you would know like how they kind of got it or somehow, some kind of a trend that is happening? Do you see that?
Well, to be very honest, it is in the community. So I think sometimes we cannot blame anybody.
Yes.
It is very instinctive for a mother who is pregnant to not do too many things, especially in this COVID era. So the likelihood of a mother leaving the house to do unnecessary things, it has come down. So she will try to, it's a natural instinct. She's going to protect her baby. Okay. Certain things have to be done, but she's going to already cut that down. But what about the partner? The partner is in and out of the house. So sometimes we have to talk to the partner or who, and it's not everybody has the luxury of just you and the partner in the house. Many of them have combined families and things like that. And everybody has to, it's an economic downturn. Everybody has to go to work. Everybody has to have different kind of, ways to earn the money. So sometimes you cannot blame these people. But I think trying to, as much as possible, if you have a member that is going in and out of the house, wear a mask all the time. Even in the house. So what's wrong with wearing a mask in the house? Sanitizing your hands and social distancing and as much as you can. But you know what? Honestly, there is a limit.
Wearing the mask in the house.
Yeah, because if you have people that are going in and out all the time, it's very difficult. But if you ask me what you can do when that person is around, wear your mask.
Interesting.
Dr.
And
Premitha,
vaccinate. I'm very for the fact that pregnant mothers should vaccinate.
Dr. Premitha, I want to take a step back. Okay, now the mom is positive, baby is negative. Okay, the baby goes back home. There are a lot of relatives, and then they pass on the virus to the baby, and then we have this situation where who's gonna take care of the baby? For adults, they go to quarantine. They lock themselves up in the room. Okay, now, so for many who lives in say low cost flats, okay, 2 rooms, generational family, lots of people there. But who is really going to be responsible for taking care of a baby that is now positive? Sorry.
So, okay. So again, using MOH guidelines, a child less than 1 year old, I think it's one year old, automatically goes to the hospital. They have to go to the quarantine centers with the parent. So even if the mother's come out of COVID, she still has to go to the quarantine center with the baby and stay there, because again, we worry about babies being immunocompromised when they come out. What is their risk of having problems with the COVID? Would they just breeze through it, or would they have complications? So they have to be monitored very, very carefully. So once the mother I'm assuming the mother has come out of that 10 days, but now the baby gets it. Both mother and baby are kept, like in Klang Valley, we're looking at Sungai Buloh. They would go into the pediatric departments.
Would frontliners consider this to be a much more complicated situation than ordinary COVID-19 patients?
Yeah, because you see, when you're pregnant, there are 2 people you're looking after, right? So, even if you get into the maternity hospital, it's just not the person sitting in front of you we're worried about. We're worried about the baby. So even though we've been told over and over again, mother comes first, but many of us would also like the baby to be well. We've all been told that whatever happens is mother first. But if possible, as a healthcare worker, I would like my mother and child be well. So looking after 2 people is always going to be a bit more tedious, a bit more challenging. And what more if the baby is out and then having the mother and baby in the hospital, then we're dealing with either are they separated, the separation anxiety, the bonding, the worry, the postnatal blues the mother is going to go through, because the hormones are anyway all up and down in that first 1 month. And then poor mother has to deal with COVID, whether she's allowed to breastfeed. It's a whole load of, it's a game changer. It's actually a game changer. It's so easy to say that, let's not get the COVID. But honestly, when you're dealing with it, the mental health issues have become the main issue in this particular COVID situation.
Yes. Zunaira?
Yeah, I mean, you're actually getting used to 2 new normals. One is the COVID situation, and then the other new normal, I mean, especially for first mothers, is like, how do I keep my baby safe, right? In this situation. And of course, like, your timings change. Every 3 hours you have to give milk to the baby, and it's a whole new normal, especially for first-time moms.
And sleep. And when you don't sleep, that's where the problem comes in.
Yeah, that's the frustration, actually. So does it cause like premature birth? Let's say I'm pregnant and I get COVID. Does it actually cause premature birth?
Not directly. So it works a little bit differently. So a woman who is pregnant, let's say she is 28, 30 weeks, 3rd trimester, she gets COVID. She can move from category 1 to 2 to much later, to 3s and 4s and 5s very much faster. So what happens? She has fever. So when she has fever, it can cause infection around that the baby, where the baby is.
Oh.
So that can then lead to a premature birth. Okay, so it's coming from that line. All right. The next thing is the fact that sometimes, not common, but it has happened, where you have a mother who is towards the late stage of pregnancy, let's say 34 weeks and beyond, because that's the danger area, getting COVID at around 34 weeks. Because, you know, if you can remember, Zunaira, you're so much bigger at that time. The baby is pushing all your lung, you know, your diaphragm up. You can't breathe very much. So can you imagine getting COVID at that time? Because then, you know, you as it is, you've got COVID, you cannot breathe so well, you're coughing, your baby is there. And if you cannot clear your lungs, your infection stays with you for much longer. Your chances of ICU and mechanical ventilation go up tremendously. So now to ventilate a pregnant mother, not easy. You've got the baby there. So what do? You have to take out the baby. So either you have to do a C-section, take out the baby, or how do we get the baby out? Yeah. So that becomes a different ball game completely, you know. So prematurity comes from the fact that, yes, you've got COVID infection, and the COVID infection has caused you to have fever, infection, and then leading on to an early delivery, or the fact that we've had to deliver this baby earlier to save a mom's life.
And talking about cesarean, I remember when because I had to go through a cesarean because of some complications. They would not let my husband in. Usually they do, they allow, I think, but because it was COVID, they do not allow the husbands to come.
Totally agreed. So we you know, with it also varies from hospital to hospital, but I can tell you with my hospital too, it's similar. So when we first started off in the initial era of COVID, which was like what, March, April, May, when no one knew what was happening and everyone is looking at CNN and numbers, you know, we never allowed anyone into the OT. Then we got better. Then we let the husbands in. Then we went on to an era where, you know, as long as the husbands are negative and things like that, we would let them in. But the minute MCO started, we know that we want to cut down that traffic in the operation theatre, because places like the delivery rooms, the operation theatres, the ICUs, they're all closed areas. We try to maintain infections, we keep the infections out. So the less people that go into these areas, the better. So now, no husbands. Again, in my own hospitals, no husbands allowed into the cesarean section. It's sad, but a lot of the nurses now try and help by taking as many photographs as they can to help you out.
Yeah,
so
they did that with mine. They even took videos and photos.
They all now become experts to try and, you know, because everyone feels sorry for you. So we try and help you out that way.
Honestly, at that point of time, you're not even thinking of your husband. You're getting yourself.
Well said. Said.
You're not thinking of your husband at that point of time.
Of no help.
Yeah, so actually you're right, because I've had mothers who, you know, previously had their husbands in for the previous C-section, and now during COVID times when they have delivered, no husbands in, and they said, hey, actually it's not so bad, lah. You know, it's really not so bad. I think they got all the attention. So, you know, everyone is feeling sorry and has got more attention to them, so they felt actually very good about it.
Okay, Dr. Premitha, you know, on this subject of going for for screening, okay? Now, Malaysians have not gone to that point. You know that most of us will only go for testing if we are in contact with somebody who has been positive, or somebody in office has been infected. All of us rush to the clinic to get ourselves tested. Not many Malaysians would take the trouble to say, okay, I want to find out what's my status, you know, am I positive, am I negative, you know? Would you recommend anyone who comes to your clinic and you will tell the patient, get your husband, go for a test? Would you do that?
No, I wouldn't, because a COVID negative today doesn't mean a COVID negative tomorrow, to be very honest. So I think it makes more sense to only do it if necessary, or if you're getting admitted, or if you're going for surgery, or, you know, if there should be a specific reason, or you're not well, you know, then you do it, because there's no point otherwise doing it. So let's say one person has got it, then the close contacts doing it makes more sense.
I see.
You know, but this, I mean, to me, otherwise, you're just, what extra info is it going to tell you? Because as I said, today being negative doesn't mean tomorrow you're going to be negative. It can change. We know results can change in 3-4 days. So being more objective about why am I doing this test, it makes more sense in my head. Okay, I mean, it's just like if you look at the My Sejahtera program right now, you have your low risk, which is nice and blue, and everyone is happy. And one day, you become yellow.
Yeah.
Because you, in that 5-minute vicinity where you went and scanned your barcode, someone else became a positive or is a positive. But it's just a casual contact. Now, I know many would run and do a COVID test, and I say, why? You're fine, what? You're healthy, what? You're okay. Do it only if necessary. I mean, we have to use that kind of, the more important thing is, we have to look after ourselves. So, masking, and if you've not been vaccinated, do your double mask. If you're vaccinated, keep to a single mask. Social distancing, washing your hands, sanitizing them very regularly. I think that's the key point. That's really the key point.
I think what I realized is everyone is wearing a mask, but nobody's really sanitizing their hands. And so I think that's where the trouble is. Like, we forget to sanitize our hands. I remember, when I was pregnant, I was going for my monthly checkups. I would actually wear gloves to the hospital. I was so scared to touch anything.
Many do. And I know what, I don't blame them. Whatever that makes you feel happier, that's very important. But I always will tell you, when you go home, you just throw those gloves properly. Just don't throw them just like that, Yeah, so you need to know where to throw them as such, you see. So, yeah, I mean, you have to look after yourself at the end of the day. And, whatever is said at the, sometimes there's no way to prevent something, but you only hope that you can do your best to minimize your risk. And that's what's really important.
Dr. Premitha, what's the update on vaccination for pregnant women now?
Well, I'm the pro person for vaccination. Okay, I'm telling everyone to go and get vaccinated because of the fact that if you can get vaccinated, you're cutting down your risk tremendously, and hopefully, everything goes smoothly for you in labor. And I think that's very important. Getting a mom vaccinated, then the complications to baby is actually much less. So, at the moment, as of today in Malaysia, you are encouraged to get vaccinated. And your vaccination zone is between 14 to 33 weeks. So now, why this magic 14 to 33 weeks is because generally, we don't like to vaccinate in the first trimester because usually we don't give you injections and things like that. We let the first 3 months go. And then you can start vaccinating. And why 33 weeks is also because you can get your second shot before you deliver. Okay. So if you're doing right now, the pregnant moms as of today can only get Pfizer. So if you're doing Pfizer at 33 weeks, then 3 weeks later, you will get your second dose and then you go and deliver.
So you're the only safest vaccine for pregnant women?
No, with many vaccines for pregnant women. All women are encouraged to get their flu vaccines every year, especially more when you are pregnant. You're also encouraged to get your Tdap, which is your tetanus, diphtheria, pertussis vaccine at 28 weeks, because it gives, when you get that vaccine, it goes through to the baby, and your baby is born with antibodies, which protects them for the first 3 months of their life. So vaccines are very common in pregnancy.
Okay, Zunaira, last question from you, and then the last final word of advice to Malaysians from Dr. Premitha before we wrap up the program.
Statistics, please give me the statistics of pregnant women in Malaysia who have been tested positive.
I wish I can tell you. I know that one day it will come.
I can't find any statistics on this.
I've been trying, trust me. But I think I need the government to sort out whatever that's going on right now, because that's the priority. I know that we will get stats. I'm very, very sure about it. But right now, they need to prioritize on what's actually happening. So let them get over this pandemic first. And then, trust me, maybe this year, next time, this year, the same time, next year, we would probably get some stats and then we can share it with the world. But right now, we can only give stats from overseas, which are actually not true local stats.
Sure. Doctor, final words from you to Malaysians, especially pregnant women who are watching this program.
Yeah, so I would like to tell all my pregnant patients out there and anyone else who's listening, I would like you to consult your doctor about vaccination. And if you are a good candidate for vaccination, please get that in to try and help yourself. But always remember that it's not only the vaccination. And, it is the whole, all the other things like, social distancing and masking and sanitizing your hands, which actually play a very, very important role together. And please talk to your partner about minimizing that in and out so that everyone remains healthy.
Yes, and
Thank
wear
you,
a mask at home. The most
That sounds
honest thing
really
ever.
it's no longer kinky, it's stay safe.
Absolutely correct. At least I didn't tell you to double mask at home, isn't it?
Thank you, Dr. Premitha, for
Thank
taking
you.
time for talking to us. And Zunaira, take care of your kid. Thank you.
Thank you.
Please,
Stay safe, everyone. Stay safe.
please like, share, follow Dr. Premitha, Zunaira, and RealChunWai, okay, on social media, and subscribe to this program if you like it. Thank you.
Thank you. Bye.
Stay safe.
Bye-bye.
Bye-bye.
Bye.